All right, last video. Gosh, I know it hasn't. It seems like it's been long videos. But anyway, all right. So your elbow joint moving down. So we've gone through again the vertebral joints, the temporomandibular joints, the shoulder joint, and now we look at the elbow, which is a classic again. Hinge between the trochlea of the humerus and the ulna, and then between the capitulum of the humerus and the head of the radius, we see this ability to do pronation and pivoting, pronation, supination, pivoting. So we're going to look at this, again, fairly stable joint, and not quite as complicated as what you saw on the shoulder, okay? So as a hinge, it just does flexion and extension, all right? With between the capitulum of the humerus and the head of the radius, right, then we get rotation in that annular ligament I mentioned, and here's an image to show that, right? And you have a lot of reinforcing and stabilizing ligaments. So we'll talk about a few of those. And again, what you need to do is be able to pick out and match ligaments to joints on your test. All right. So here in this image, as we're looking from two different perspectives at the elbow itself, right? So we've got the ligaments that would help us stabilize the joint are the ulnar collateral, all right? So the ulnar collateral ligament, so here's our ulna so we're looking at from a medial view here. These ligaments are attaching from processes to these epicondyles, right, and of course the medial epicondyle, and they help to, again, stabilize the joint. The annular ligament, shown here, is going to help to control or provide a track for the head of the radius to rotate in. If we look from the other perspective, laterally, we see the radial collateral ligament, and this again would be between the lateral epicondyle in this case, and it would actually make contact with the annular ligament. All right, and we aren't going to talk about any others for the actual elbow. For the hip joint, another like the shoulder joint, ball and socket, so quite a bit of motion, huge range of motion, but it's a little more stable. And here's one of those examples that are a trade-off, right? You want a lot of flexibility, so you have a range of motion in the lower limb, but you've also got to support the weight of the body. So you see a much deeper, right, depression called the acetabulum here in the coxa, and a more elongated ball in the femur, right? So it is an extremely heavy capsule, so it's really plastered in place, if you will, by all these different ligaments, and we're going to get to know a few of these. Again, the idea is the names will really reflect and help you understand where you are in the body. All right, so there's an iliofemoral, right? So you should pick up that is a hip joint, right? And the iliofemoral, so between the ilium and spines on the ilium, all right, to the trochanter, right? So that's a big, thick connecting place. So the ischiofemoral, so a little more posterior, right? So the ischiofemoral would be on the ischium to the acetabulum, so in there. The pubofemoral, so that would be an anterior because the pubis bone is in the front, right? So we're looking at two different perspectives here. So the pubofemoral is going to extend between, the superior portion of the pubis and then and actually attach that iliofemoral joint. Ligament. Now note, I'm not going to ask you these specifics on a test either, so don't go thinking, oh my gosh, I have to figure out how this ligament connects up. I'm really just going to use their names and ask you to tell me what joint you find them in. So don't become obsessed with knowing that for anything more than your own anatomical curiosity. All right, in the knee joint, which is our most complex joint and a joint that, of course, takes an awful lot of damage, position and movement. So we have this joint that's formed between, of course, the femur, the tibia, which make direct contact, and then the fibula, which doesn't actually directly contact the femur, but is part of this joint, and, of course, the patella in the anterior aspect, so lying over this. So here we're looking down on the joint, looking from the side. Here we've cut away the patella and we're looking from the front. Okay, so we have, of course, these very broad medial and lateral condyles on the distal epiphyses of the femur. Then they combine with a medial and lateral condyle on the tibia. All right, so the femur articulates in front. You see it lying, the patella lies over the femur. So we get flexion, extension, and rotation of this joint. And it is also strengthened, like the hip joint is, by a number of different ligaments and tendons. This time we mentioned menisci, so these pads of fibrocartilage that help to reduce friction. And there's also, like the shoulder, a number of bursa. So we're going to take a look at these. This is the anterior cruciate, so cruciate cross, and that's exactly what happens. It crosses here, and there's a posterior cruciate that crosses from the opposite direction, basically. And these help to stabilize this as well, but these are often damaged when the knee gets hit from the side or hit and it's moved in a way that doesn't run in the direction of these fibers. All right, so here what we're looking at again, we're looking at an anterior view and a posterior view, right? Because this is the popliteus, which we know is the back of the knee, and here we talk about the patellar ligament. So this is the one that, attaches to that tibial tuberosity I was talking about in lab. So here, these ligaments, of course, there's one called the patellar ligament I was looking at here, goes from the margin of the patella to the tibial tuberosity. So the patella would sit right over here. We just removed it so you can see. Here's an anterior view of the anterior cruciate ligament. All right, the posterior coming from the backside. There is an oblique popliteal, and so we know that's going to have to be running at an angle and behind the knee. All right, and I say here again, I'm telling you where they connect, but I won't ask you this on the test. It connects the lateral condyle of the femur to the tibia. Okay, and you can see this idea here. The arcuate, and arcuate actually means Y-shaped, popliteal. So in this case, you see that nice, it kind of pops out at you, if you will, right? Extends from that, again, the lateral condyle of the femur to the head of the fibula. So we're binding up this femur to these other bones and allowing movement. Right. So there's a tibial collateral, just like you had, again, the ulnar collateral and a fibular collateral. So tibial on the medial side, fibular on the lateral side. And these connect the condyles of the femur to these two bones and stabilize them. You see there's bands here and here, right? The two ligaments within the joint, I've already pointed out, are called the cruciates. They cross, that's why it's cruciate. And they help prevent displacement, but can be displaced with enough force that hits them. All right, we said there's menisci here, so these are fibrocartilage pads, and they're kind of just drawing them in there so you don't really get a good feel for these, but they separate the femur and the tibia and cushion tibia and cushion this. All right, and then there's several bursa. So the suprapatellar, the prepatellar in front of it, so above it, in front of it, below it. And again, these are all to reduce friction and rubbing, right, between muscle and bone or skin and bone, okay, in these cases. Your ankle and foot joints, moving down a little further, all right, so the talocrural joint, remember the crural is the region that's in front of your leg, sural is the back, so talo to talus, the one of the tarsals, it only moves in one direction. This is a hinge joint. When we were talking about the idea of being able to do your dorsiflexion and plantar flexion, this is what the joint we were directing your attention to. All right, and so there's a subtalar, all right, so between the talus and the calcaneus, so something that's holding these two bones together. So the talus is what supports and articulates with the tibia, and then the talus connects to the calcaneus, which is your heel, and that's one tarsal. These are plane joints, and then we saw eversion and inversion, so I'm just reinforcing that here, and that's something that would be good to know. The ligaments here go from medial or lateral malleolus, right, or malleoli, from the lateral malleolus on the fibula, and the medial malleolus on the tibia. So we're looking at the foot from two different perspectives here. And so go from these malleoli to the calcaneus and talus, and they prevent this foot from just moving a whole lot. And then, of course, these are all basically little ligaments that also stabilize the tarsals and metatarsals. All right, so that pretty much takes us through what we need to know for articulations. I hope you don't find this too boring. I really do. It's kind of dry, but wade through it, think about movement, do the movements if you're bored, right? And make sure you're, again, assigning names of ligaments to specific joints.